Hello, I am Dr. Hazzaa, working as a radiologist at Queen's Hospital. This talk is intended to serve as a good introduction to a CT head. To start off, we will briefly review some key concepts and discuss the basic principles of CT. We will also learn some basic relevant neuroanatomy, and we will introduce a basic conceptual approach to the CT scan. At the end, we will go through multiple cases. Basic principle of CT. The most prominent part of a CT scanner is the gantry, which is a circular rotating frame with an X-ray tube mounted on one side and a detector on the opposite side which receives the X-ray. A fan-shaped beam of X-ray is created as the rotating frame spins the X-ray tube and detector around the patient. As the scanner rotates, several thousand sectional views of the patient bodies are generated in one rotation, which result in reconstructed cross-sectional images of the body. Next, we will discuss windowing, which is the utmost important when looking at CT heads. It is very easy to miss key findings if you don't window appropriately. So what is windowing? In CT, housing field unit measures the radiodensity with a range of 2000 shades of gray, that is beyond the grayscale resolution of the human eye. CT images can be reconstructed using different algorithms, and their dynamic range can be visible by windowing by adjusting window level and window width. So what is the window width? It is the range of housing field unit of all tissue of interest displayed in different shades of gray. Tissues with housing field unit outside this range displayed as black or white. So what is the window level? It is the central housing field unit of all the numbers in the window width. This is a quick review again. I can emphasize how important it is to know the basic radiographic densities and to know the housing field figures. The housing field is a measure of densities from -1000 at the least dense structures to the +1000 at the most dense structures. By convection, 0 is water and a -1000 is air. Everything else is calculated based on that. The cortical bone and the metal are very dense structure near +1000. Soft tissue is above 0 and measures around +50. Fat is less dense than water with nearly around a -100 to a -10. Now let's focus on the main densities that we are going to deal with in the brain. In the skull, we have the brain itself sitting in a bowl of CSF. The brain consists of mainly gray matter and white matter. The gray matter mainly found in the cortex as well as in the gray matter structure in the deep of the part of the brain, such as the thalamus and the basal ganglia. Gray matter consists of neuronal cell bodies and measures about +40. White matter is made up of mainly myelinated axonal tracts. Myelin is fatty substance and the fat has a lower density, so white matter measures around 25, which is less than the gray matter. CSF is low density and it is mainly water, and it measures around 15 positive. These actual numbers are not really that important. Instead, we should understand the basic principle here. CSF is near water density. Gray matter is slightly more dense than the white matter. Lastly, we will introduce the acute clotted blood, which measures around +70 to +50. The principle is to remember here is that acute clotted blood is denser than the rest of the brain. All the densities that we are looking at here are in a tiny range of densities. That's why windowing is important when we are looking at the CT brain. These are window examples. For head CT, bone window and brain window are two important window settings. Bone window is useful for visualizing the detail of bony structures and also to identify subtle skull lesions. However, the details of soft tissue, such as brain, that shows density lower than that of the bone, are lost in the bone window setting. Brain window is the most frequently used setting, and the majority of evaluation of brain abnormality are done using this window setting. Brain window can show differences among different types of soft tissues, such as brain, blood, and vasculatures, and also air-filled structure, and also fluid-containing spaces. Other less commonly used windows include blood window and subdural window, which are optimized for depicting blood and subdural fluid, and they also provide detailed information on soft tissue. For example, the blood appears hyperdense on CT, and it measures between 50 to 70 positive Housen field unit. Calcification is more than 100, bone is more than 1,000. The contrast in the vessel is also hyperdense, and it is ranged from 175 to 200 positive. CT angiography also appear hyperdense, and the tumor enhancement when we give contrast when in the intrabrain tumors or intraaxial tumor or extraaxial tumor as well. The hypodense structure like infarct. So the early infarct measures between positive 10 and 20 Housen field unit, and the old infarct range between 0 and 10. Hypodense structure in CT head is also as edema and masses. Water, like CCF, as we said, is around 0 to 15 positive. Fat is between negative 30 and negative 70, and the air is around negative 1,000. So we can here find the hemorrhage with a hyperdense, and it is surrounded by hypodense perifocal edema. This is the white matter, and it measures here between positive 20 to positive 30. The bone is positive 1,000. Here is the muscle or the soft tissue structure of the CT brain, and it measures between positive 20 to positive 40. As we said, this is a gray matter. It measures between positive 30 to positive 40. Hemorrhage is between positive 65 and positive 95, as depicted here or measured at this particular slice. Fat is between negative 30 to negative 70 at this particular slice, and the air is negative 1,000.